you and I, through your labs, basically you were on the luteal phase of your cycle. It's important that when we check hormones that we are knowing what part of the cycle, because hormones change throughout the month. And so during the first part of the cycle, they're going to be different than towards the end. But your labs are not normal. But normal.
It's okay, I've never
course,
been
yeah.
normal.
And normal doesn't necessarily mean that they're different than they ought to be. They just are the way they are for you. But I think that there's some explanations about your whole history here that maybe could have been explained if labs were tested earlier. And frankly, sometimes they didn't have the ability to test the labs years ago that we can do now. It's really important when anybody has this abnormality, you have to make sure that you have plenty of vitamin D. It's important anyway. We like vitamin D levels to be around 60. Your vitamin D level was 32, so I would definitely supplement with vitamin D. Lower than normal vitamin D can increase your risk for osteoporosis, but also certain cancers. So again, vitamin D, easy to take. For some reason, 85% of my patients have vitamin D deficiency. 85% across the board. I've done the studies. October and February, I have you take a little bit more vitamin D, and then, in the summer months less, but you're going to need vitamin D.
Okay.
I did check thyroid. I always like to check thyroid. You do have some symptoms that suggest that your thyroid's a little bit low. And no one could fault us if we gave you thyroid, but I don't think you need thyroid right now.
Okay.
It's something that we'll want to watch though. We'll probably want to check a thyroid on you at least annually. And if you're having a lot of low symptoms of thyroid, dry hair, dry skin, lots of hair loss and stuff, then we may want to consider thyroid, because you can't always go by labs. And that booklet that I gave you, if you reviewed that, we are treating you, not the labs. We've got to look at the labs, but there's, and I mean hundreds of patients that benefit from thyroid even when their labs are low normal.
This stuff is awesome.